Allergic reaction and drug toxicity to medication. An allergic reaction is immune response. It affects the immune system. The medication, it's basically trying to fight something that's foreign, like that your body doesn't like. It's like an invader coming into a city, and the guard's trying to fight it off, but it like fights it off with, the symptoms on your body and the signs you'll see. You can be allergic to medication and food. Sometimes they coincide. Like if you're allergic to shellfish, you might be allergic to iodine. If you're allergic to eggs, you may be allergic to the flu shot. I have a video.
My name is Mary Beth Fasano, and I'm an allergy immunology doctor at the University of Iowa. I'm also a fellow of the American Academy of Allergy, Asthma, and Immunology, and I wanted to talk just a little bit about allergic reactions. An allergic reaction is the body's immune response to certain substances called allergens or antigens that are found in our environment. Although we are all exposed to these substances, these allergens, only some people develop sensitivity or an allergic reaction to these allergens. Now, what things might trigger an allergic reaction? Well, there are many things. It can include seasonal pollens, things like dust mites, cockroaches. Also can include molds, certain foods, medications, and even bees or other stinging or biting insects. The symptoms of an allergic reaction can range from something very mild to even something that can be quite severe and even life-threatening. Some examples might be for someone who has hay fever or seasonal pollen allergies. Their allergic reaction might be symptoms of watery, itchy eyes, or sneezing, or runny nose during certain pollen seasons. For someone who has asthma, who might also be allergic to cats, their asthma symptoms may worsen with some wheezing or some dry cough should they get around that cat to which they are allergic to. In some cases, the skin can be involved in allergic reactions. You can get itchy skin, red skin, some flushing, even sometimes some welts or some swelling. In some cases, the gastrointestinal tract can also be part of an allergic reaction where someone might get some nausea, some vomiting, maybe some belly cramping or pain, and even diarrhea.
So here are the different symptoms, signs and symptoms of an allergic reaction. You can have be swollen around your mouth, itching, hives, trouble breathing, wheezing, and then you can have an extreme allergic reaction, anaphylaxis. And this is like when you get hives and trouble breathing all at the same time. You could start wheezing, all different types of stuff at the same time. Then there's drug toxicity. This is when it's too much damage done by a drug, like if you take too much, and this can happen from like misusing or even just taking too much and like not looking at the directions, like taking a couple extra, thinking maybe it might help. It's gonna be intentional or accidental. That just comes from both. It can be intentional because you can actually be wanting to take a lot to harm yourself. Like if somebody wants to commit suicide, something like that, or people just do different things. Here's different symptoms of drug toxicity: feeling sick, abdominal pain, fever, diarrhea, appetite decrease, and even overdose. This is like when too much is taken and it's overwhelming the body. It's a weak pulse, very slow breathing. The skin gets very clammy, like wet, and you know, it could even lead to death. Here's a video.
Most drugs act like poisons. They don't harm us because they're taken in small amounts. Taking one amount of a drug gives the desired effect, but too much of that same drug can cause illness. Some drugs can cause health problems, even when they are taken at the correct amounts. Drugs that can cause health problems are said to show toxicity.
I will then ask some questions to the class. What would an adverse reaction to a medication affect the immune system? That would be an allergic reaction. What is drug toxicity compared to? This is compared to like drug poisoning or something like that. If you're allergic to shellfish, what might you be allergic to? And that would be iodine, which is not a symptom of drug toxicity, and they all are except swollen face. And what is a symptom of allergic reaction, which there are many different, so anybody could say any different one. And then I have the answers on the next page. I would then do an activity where it would be the side-by-side of the guys, and then they would just have to point at which one it belongs to based on what it is. It can be signs and symptoms, or what it's defined as, or what happens. And here's the answers on the next page.